the urban debate. Here at the 9 p.m. conversation now, I am going to put the spotlight on Karnataka, a state that was actually doing great in terms of its fight against coronavirus. Much better than all of the other big states in comparison. And I am going to specifically also talk more about Bengaluru, a city that many experts quoted as a model city where it came to dealing with coronavirus. Just in the beginning days, it was Bengaluru that reacted quickly with Kerala, did exhaustive contact tracing, screened, isolated the cases, and kept its numbers low. Will you believe it, viewers, that even up till the first week of June, when cities like Mumbai and Delhi had 30, 40, 50,000 cases, the city of Bengaluru didn't even have 1,000 cases. And since then, there has been a 1,000% jump, an astronomical jump in the number of cases in Bengaluru. Now, one big part of this has been also because people have travelled from abroad, people have travelled from the other states, and that may lead to the jump. But that's not enough, and that's not the only reason. Over the next half hour, we are going to talk about how and if the Bengaluru model has failed. And why is that? Did we get overconfident? Did we lower our guard down? Did we forget to implement containment measures? Did we forget to follow lockdown norms? Did we not screen enough? Did we not test enough? How is it that suddenly now Bengaluru is looking at such a large number of cases, from 386 cases as of 1st June to 9,580 cases as of July 5th? Think about that. This is when every other city is finally getting a grip on its cases. Something has terribly gone wrong here. Not only that, viewers, the second part of my conversation is going to be about how the city is now struggling with a shortage of medical staff. Many of them are in quarantine after having come in contact with infected patients. But many of them are too scared to turn up to work. And that is causing a big concern in the city of Bengaluru right now. So without wasting any more time, let's say good evening to the panelists who are joining us right now. Dr. Narendra Rangappa, member of State Executive Committee for the BJP in Karnataka. Dr. Sylvia Karpagam, public health doctor and researcher, joins us this evening. Aishwarya, national spokesperson for the Congress Party. And Dr. Prasanna, president-elect at a private hospital and nursing home association, and he heads that association. Dr. Prasanna, if I can speak with you first and begin with you. What has changed suddenly in the last 1 month?
Suddenly we have a huge spike of cases which are coming up in our city, Bangalore. That is a huge concern right now. As you told, the number of cases have increased, right, left, and center. At the same time, there is a huge confusion between various government agencies. There is no single-minded approach or a single-headed approach who is heading the operations here. There are multiple agencies which are working at their own whims and fancies. There is no clear-cut policy. Whatever we did in the first 3 months to achieve a huge praise from our Prime Minister and other states has all gone in vain in the last 2 weeks.
Okay, I had a bit of an audio trouble there, but let me just quickly go across to Dr. Narendra Rangappa. Dr. Rangappa, from 386 cases in the first week of June to this exponential rise that we are staring at today in Bengaluru, will you admit that while Bengaluru was the star of the war against corona in the first 2 months, something somewhere went wrong and we were not able to keep up with the rules and regulations?
No, let us look at it this way. As you already mentioned, that when the lockdown was removed or it was unlocked situation, we had a lot of travelers coming in from the other states, and we had allowed international travel also. So similarly, see, the number of cases reported are directly proportional to the number of tests that are being done. As we go on doing more number of tests, it is very obvious the number of cases are going to increase. At the same time, I should say that there is a excellent team from Government of Karnataka that is working. We have Dr. Sudhakar himself, who is a doctor. We have Dr. Ashwatnarayan himself, who is a doctor. And we are ably aided by Mr. B.S. Yediyurappa, the Chief Minister. And we are well assisted by so many other officials, revenue officials, ASHA workers, police. They have risked so much that even they have contacted this infection in a lot of areas. That doesn't mean we have let our guard down. There are so many other factors along with these what I have mentioned that have increased the number of cases. Definitely one factor is true, that as we go on increasing the number of tests, number of cases also will be positive. But look at the rate of growth of the infection. It is well under control compared to any other state or any other metropolitan.
I don't know if you want to call this well under control. If in the first 3 months you got less than 500 cases and suddenly you're looking at 10,000 cases, I don't think it's the same situation at all, Dr. Rangappa. And if you say there are several other factors, what are these factors? Help us understand.
Performed and the positive rates are directly proportional to each other. So you go on increasing the number of tests, definitely we are going to detect more cases, and definitely we have increased the number of testing. We want to do as many tests as possible so that we can identify the people and we can send them into isolation. This is one of the major factors. But you should also look at the growth rate. The growth rate is well within control compared to other states and metropolitan town. And depending on the population density also, I think we have not lost it completely anywhere.
Let me bring in our other experts as well. Dr. Karpagam is joining us right now. Dr. Karpagam, while the government may want to believe that we've lost control or we didn't do anything wrong, fact of the matter also is that we've shown series of reports and report after report in the last 1.5 months of how lockdown norms were not being observed. Containment zones had free-flowing traffic, free-flowing movement of people. Barricades didn't make any sense. There were some markets that themselves claimed that they're going to shut down, but they didn't. And in fact, these traders went ahead and locked their hands with the government on whether or not the markets should shut down or not, even when the cases were spiking. What is your own reading? Apart from the fact that we've opened our borders for travel and that may have increased cases, is Bangalore's model system now crumbling?
Thanks, Tanvi. See, with any pandemic, this is the expected course. You would expect the number of cases to rise, and you would expect, the complications also to take place. And the whole purpose of a lockdown is to prepare for that. Because we're talking about people and people breaking down lockdown rules. But there is also the whole role of the health system and how it uses that opportunity to prepare. And if you look at what's happening in Karnataka, of course, through the lockdown, people went through a lot of difficulty. And more than the rising cases, for me, the concern is that people who are seriously ill, whether it is COVID patients or non-COVID patients, pregnant women, people with accidents, they, over the last 1 week, it's like literally a horror story where people have been running from hospital to hospital, frantically calling, asking for beds, asking for ICUs, asking for ventilators. And a lot of patients have died, between hospitals. And now, like after all this, we hear the the government making statements like we will have booth level committees, we will release detailed guidelines for home isolation, we will make arrangements for telecommunication, we will have at least 2 ambulances in the each of the 198 wards, we will have real time information about beds, and we will increase the testing from 15,000 to 25,000, and we will set up facilities to reduce the crowding in the hospitals. Like we will have primary and secondary and tertiary level facilities. Now the question is, like, what were you doing till now? Like, why do you need people to be so desperate and people to lose lives and loved ones, and then you're saying we will do it? So this is the whole idea of preparedness, and clearly the system is not prepared. And the private hospitals, and I think this crisis is artificial, in the sense it's not for lack of beds. We've seen cases after cases who test positive and who just go and get admitted in hospitals, and they stay there for 10 to 14 days. They don't need
Yes.
they don't need ventilators. They're people who can very well have been managed in a primary or secondary level facility or at home. Asymptomatic people have occupied the beds which should have been reserved for seriously ill patients. So this is not something that you cannot plan for.
Yes.
It's not an unexpected outcome. It's completely due to lack of planning. It's due to poor triaging systems, and people have no clue. People are using Twitter to ask, where can I get a bed? I mean, people have been so desperate in the last 1 week.
Okay. Before I get the BJP to respond to this, let me also bring in Aishwarya Madhav. Aishwarya, this is the other thing that I wanted to raise, and of course, we already have a panelist raising this point. Fact of the matter is that even though Bengaluru has had such low cases, and we've all appreciated the steps that were taken, we've highlighted it, we've actually used that information and the steps taken by the authorities to question the other states and cities. But like Dr. Karpagam said, look at what's happening today. When the cases are on the rise, which can happen, we are struggling with the health infrastructure. Should we not have used this time to build, even if the city traditionally doesn't have enough beds or hospitals?
Tanvi, first and foremost, I think Dr. Kalpagam is absolutely right. And I think what you're saying is, perfectly correct to what is happening in this situation. During the lockdown, we seem to have basically grown complacent and thought that we'd already ridden out the worst. But the minute you unlocked, you saw that, cross-border migration creates such an influx that it put a pressure on the healthcare infrastructure like never before. Tanvi, this is shameful because Karnataka is one of the states with the highest number of medical facilities and medical colleges anywhere across the state. But you see three major things. One, inadequate planning during the lockdown, because the government could have ensured at least 10,000 beds. In Bangalore, we have only 4,000 odd beds, out of which at least 2,000 something beds were already occupied before this whole indoor stadium was created for asymptomatic patients. The second thing that you see is that, there's interfighting between the state authorities and the city corporation, because they seem to be framing a duplicitous rules. And third, Tanvi, I think it's very shameful to say more cases are coming out before we're testing more. The fact is not that. You have to test mandatorily, but the fact is you work towards containing the virus, whether with your containment zones, with your active policies, or any other policy interventions. Let me give you a few statistics, Tanvi. The government cannot trace the source of COVID to at least 9,000 patients. Right? Out of yesterday, the 1,800 odd cases in Bangalore, they don't know the contact source for 1,019 of them. And Sriramalu says there is no community transmission. Next, you see there are massive allegations of a scam also in the government with PPE and ventilators and masks and sanitizers to the tune of 2,229 crores. What the government has done systematically, it has endangered more people. It has endangered the health infrastructure, especially ASHA workers, nurses, and doctors. And now they're paying the price. Rather, they are not paying the price. The people of the city and the state are paying the price. And this is something that everybody should know. And I really want to see what the BJP can say as a response to any of this.
Well, I'll ask the BJP. Dr. Rangappa, up to you to respond to this.
See, the Congress spokesperson is making ridiculous claims without any basic facts or figures. She says there are only 4,000 beds in Karnataka. Ridiculous. If you go into our COVID dashboard, you can very clearly see the total number of beds, where they are available. We have got around 23,896 beds for COVID all over Karnataka. Only in Bangalore, we have 3,879 beds only in Bangalore. And in this, the occupancy rate is quite low. Oxygen demand beds are only 0.9% occupancy, ICU 5.4% occupancy, ventilators 1.6% occupancy. Today itself, our government has inaugurated a 10,000 capacity isolation beds, another 3,000 in palace grounds. This 10,000 bed has come up today, just today in the exhibition grounds. Then we have another 750 beds in the university campus. We have got 250 beds in the Dayanand Sagar University. There are around 20,000 beds available for isolation. And we have got 1,981 beds that can be giving oxygen to the patients. We have got 289 ICU beds. We have got 254 ventilators. And what more we want to do, and we'll do that. And I am sure Mr. D.K. Shivakumar should have been very aware of the situation when he had that huge swearing-in ceremony of his. And it's a ridiculous thing that many of the
Dr.
representatives,
Rangappa,
MLAs, MPs...
Dr. Rangappa, I'm glad you raised this issue. But you know it and I know it, and Aishwarya knows. Actually, Aishwarya knows it very well because she's been at the receiving end of my questions and barrage of questions on this issue multiple times. But Karnataka is actually topping the list when it comes to VVIP violations, Dr. Rangappa. So let's not go there, including BJP leaders, including sitting ministers, including the health minister of Karnataka. So let's not talk about VVIP violations. It's going to start a whole different debate. Leaders of Karnataka, instead of actually leading from the front in observing the norms, all of them, irrespective of their political party, have failed in that. And which is why it's very difficult for you to now blame the people for not following the norms, because you did. But I want to come back to the point. There is no denying that there is a shortage, and there was a massive shortage of beds until the government in the last couple of days moved to include more private hospitals and open up those private hospitals and their beds for COVID. Now that's fine. That's what everybody else did. I am surprised the Karnataka government waited till now to start working on this. The whole idea of a 3-month lockdown was to build... The whole point about the 3-month lockdown, Dr. Rangappa, was to build medical infrastructure. What is the occupancy rate?
Madam, if you look at the occupancy rate, we have definitely gone ahead. We have not waited for the situation to worsen. We have planned in advance. See, when the occupancy rate is less than 16% in the number of beds in the Bangalore city, then what is the hurry? Why are the opposition jumping their gun? And I think opposition also have got their duty to cooperate.
I don't think Dr. Sylvia Karpagam is part of any opposition party. Neither are my reporters who have been bringing these reports. Okay,
Madam, like
Dr. Sylvia Karpagam, do you want to come here? Here is the BJP saying there is no problem of shortage of beds and hospitals.
I think there is...
Dr. Sylvia, we are going to get more number of beds.
I think there is...
3,800 beds in...
There's a confusion...
One at a time, please, Dr. Sylvia. Dr. Sylvia, yes.
I think there's a confusion among the government authorities of what a bed means. And I think they literally think putting a bed in a place is, can be counted as the number of beds. But that's not really the case. If you're having, fever clinics, you need to have at least basic amenities. You need to have water in the toilets. You need to have mugs. You need to have food. You need to have bed sheets. You need to have cleaning, you need to have sanitizing facilities, and most of them don't have that. They're just beds being put there and counted as the number of beds that are available. And if you look at the secondary level facilities, which is basically the dedicated COVID health facility, they should have a healthcare provider, even if it's a nurse, if there's a shortage of doctors. And definitely there should be a fully functional ambulance 24/7. There should be oxygen. And we are seeing that all these facilities have nothing, which is the reason why the occupancy is so low. People are scared to go there. If my parent or my father or mother was sick, and the fear is, if I go to this dedicated COVID facilities, if they develop a complication, there's no way that I will be able to reach a hospital in time. So let's go to the hospital right away. So a lot of people are going there out of panic, and the way the private hospitals function is, people who have influence, people who have money, are the only ones who have access to these private hospitals. And the more sick you are, the more you have to pay. And if you look at, like, there's a doctor from Fana who's there. If you look at the kind of pricing the Fana has given, it is ridiculous. They're already charging anywhere between 50 to 60,000 per day. And the guidelines they're giving, they're saying we won't cover for comorbidities, and they're budgeting for like tests, CT scans and blood tests and kidney function tests, liver function tests every day. Like, why would you need to do all those every day? And they're saying we will not cover for expensive drugs. We will not cover for comorbidities. So how are patients going to pay for all this? So it's not just I don't think the issue is just about the cases arising. I think, like, what has the system done to be prepared for it, and who's gaining from it, who's making money out of
Yes,
it, what are
you
the
know, and Dr. Sylvia Karpagam, there is another angle to this that I want to highlight. You're right. It's about how the system has been prepared. And there is one other problem that the system is facing right now, which needs to be addressed immediately. I actually want to play out a clip, and I want you viewers to also watch this. This clip shows you the burden that the medical fraternity is going through. This clip also shows you the extent of the need for more doctors and nurses and the medical staff. Now, we are being given to understand that many are not reporting to duty due to fear of infection. That's a big challenge. Listen into this really heartfelt appeal being put out by a doctor, asking his own colleagues and those from his own circle to report to duty. Listen it.
I came this morning at 7:30 and it's like 12 o'clock in the midnight right now. Patients are continuously calling me because their fathers are breathless, their daughters are breathless, their brothers are breathless, and they cannot find a room in Bangalore. And at this time, you see me, there's one Mr. Shiva here, there's me, and there's no other doctor willing to come and work in this hospital at this point of time. I have beds, I have oxygen beds, I have ventilators, I have everything. Look at all the equipment that we have. I have another 30 beds like this, but I don't have doctors working here. I find them all on WhatsApp. I need 6 hours of your time a day. Please, this is my fervent request. This is the time to show that we care.
You heard that, viewers. Look at the burden that doctor will be going through, that he had to put out such an appeal. But this is actually reflective of the big problem, and Mirana reported on this today. We had lots of inputs coming in from across the city of Bengaluru. Dr. Prasanna, why is this happening, and how do we solve this?
See, Tanvi, what has happened is, right now, I would like to take this question first. See, almost about 30% of the nursing staff disappeared from the workforce as soon as the lockdown was implemented. Most of them, they didn't return back to their duties. And again, once we started the work after the lockdown was removed, most of them are afraid to work. And some are above 50 years with comorbidities. They are unfit to work for this COVID work. So most of our private hospitals, especially the small mid-level hospitals, are working with less than 50% of the nursing and other healthcare workers. Even we are ready to pay double the salary, nobody is coming to work. So this is the huge scarcity of human resources which the healthcare sector is facing. Over and above that, the government is not doing any kind of a monetary or economic stimulus to help the healthcare sector. At the same time, the government has increased the salaries of all the healthcare workers working for the government to the tune of almost double. The same we have to replicate in the private healthcares. And already we have been paying for 3 to 4 months due to the lockdown, and without any revenues, we have paid up the salaries for most of the
Yes,
staffs.
yes. This is the big problem. The fact.
So
Okay,
now
increasing salaries may be one way. Yes,
one
go
way
ahead.
we have to increase the salaries, and the government is no way helping us. And even the MSME stimulus which the central government announced, most of us, 99% of us, have not received even the bank loans which we have applied for. So most of it is on the paper, but it is not reaching us. So without any economical viability, we are unable to convince the nursing and other doctors. Basic shortages among the nurses, ayas, and ward boys, and the basic duty doctors. So the government, unless they give us more workforce, see, it is not the government or the private. It is a big pandemic. All of us have to work together to overcome this. So the government should stop telling this is private, this is public. We should all work together. They should spare some nurses from the government department. Even the nursing students will do. They can use the final year MBBS students, and most of the postgraduate students, they are not doing anything. They have given their exams. They are sitting at home. We can call them back to work. So the scarcity, unless we work together, we cannot overcome this. And second thing, I want to answer what Sylvia Karpagam told. See, she's talking about the cost right now. See, what is the cost of treatment? It has been done scientifically. It has been done by Indian Institute of Management, the Ramaiah Medical College, and Apollo Group of Hospitals. See, the government has capped the treatment in the private sector already. So nobody can overcharge that. And it is a frivolous allegation what she is telling, that we are charging 50 to 60,000 per day. See, the government has capped, even if there is a ventilator patient, it is only 25,000 per day. It has capped this one, unless you use very high-end drugs like remdesivir, or you do a plasma treatment, which is chargeable extra. Otherwise, it's all capped, and it is scientifically been given to the government, and whatever rates we gave it to the government, they've already reduced 30% of it. And the huge burden we are taking is 50% of our beds have been asked by the government to give it for the government scheme patients, which the rates are very ridiculously low, where we can't even recover the working cost. So we are going through a huge phase. And Dr. Narendra was telling that they have a huge pool of beds among the government. Then why people are dying on the streets? Why are they not putting them in the isolation beds? Why are they not picking up? The main problem we are facing is because of multiple agencies. There is no coordination. That's why the patients are suffering and dying on the road.
Okay, Aishwarya Madhav wants to make a point, and then I'm sure Dr. Rangappa would want to respond to all of this. Go ahead, Aishwarya.
I agree with what Dr. Prasanna said about adding capacity building, and bringing in more people. But the one thing I want to bring out here, Tanvi, is also the safety of these people, which is what is keeping away a lot of people from actually coming out and working. Right, let me talk about PPE kits, and you've seen the sort of malfunction in PPE kits that are happening. The government procured, 4.89 lakhs worth of PPE kits, which would have cost 65 crores, but they spent 150 crores on it. But reports time and time again are coming out about how they're faulty. In a lot of medical institutions, doctors are protesting, saying these PPE kits are putting us at risk, and a lot of doctors have tested positive. I think the government, especially in terms of the implements and the safety measures it could have taken for doctors, healthcare workers, it did not do that. And first, there's the risk. Second, there's the stigma of being in the healthcare sector. And third, there is non-payment. Let's make this also very clear. The health infrastructure is also crumbling because, a lot of the government emoluments, or the money that has to come in, or even basic payment, has not come in a lot of cases. And Tanvi, I want to highlight one important thing which we see across the state, not just Bangalore, is the plight of ASHA workers. ASHA workers and Anganwadi teachers are expected to survey house to house, door to door. These are the frontline warriors in rural Karnataka, protecting and surveying and doing the reports, and they have absolutely no safety measures. The government seems to have procured massive amounts of implements, but nothing for them, and you're endangering them, which is why you're seeing them move away en masse. And for your information, on 10th of July, the state ASHA workers are going to be protesting because their demands have not been met. In Davangere, in a college, you've seen how the government hasn't paid out for a lot of this stuff that is there. And this is happening all across. And this is what the government has to take into account. Infrastructure and capacity building should have been done. And second, your priority has to be safety of these healthcare workers, because it's cyclical. One doctor gets it, he can take out 10 doctors with him by being primary contacts. You can completely empty out the health infrastructure, like, human capital wise, by just one man getting it. And that is what the government is failing to realize.
Okay, Dr. Rangappa, please respond to that. Multiple issues that have been raised by our panelists, right from the shortage of medical staff to payment for the medical staff and a clearer system being put in place. Go ahead, please, respond.
Number one, there need not be any panic regarding the number of beds. We have got adequate number of beds, enough and more, and our COVID executive committee team, led by leading personalities in their own fields, have been working day in and day out, and we have got enough number of beds. We have got 23,000 odd beds in the Karnataka state. In Bangalore itself, we have 3,879 beds in Bangalore city itself. No patient will die of negligence on the road. I am very sorry to say that Dr. Prasanna, where he made an allegation that the patient died because of the negligence of the government. No, it is not correct. Number two, we have already overburdened the nursing staff. We have already overburdened the ASHA staff, and the ward boys and the other paramedical staff have been working day in and day out beyond their capacity. Unfortunately or fortunately, we have got a small deficit in the number of nurses that we are having. But at the same time, we should not forget the yeoman service that they have been doing to the human kind in this sort of a situation. And I would welcome more volunteers to come forward and work. At the same time, they should not put themselves at risk also. Number three, regarding the corruption allegation that my dear friend Aishwarya is making, the Chief Minister himself has gone and challenged Mr. Siddaramaiah to come and prove out the allegations. He should not go on making allegations and making false claims at this hour of pandemic, where every person is hurt in a different way or in a small way. I am very sorry to say that this sort of an attitude is not going to help anybody. We want the
Dr. Rangappa, you are also a man of medicine and science. Please don't use pandemic as an excuse.
And if any of the members in the
Dr.
panel
Rangappa, please don't use pandemic as an excuse to stop people from raising issues and to stop people from asking questions. When Karnataka and Bengaluru was doing a great job, Dr. Rangappa, you have to listen to me. You have to listen to me, Dr. Rangappa. There is no need for a monologue from anybody. Please, when Bengaluru was doing a great job, we all got together and we said Bengaluru was doing a great job. Now you're not. Denial is not going to help you at all. If the cases are on the rise, the accountability lies with the government. If there is a shortage of medical staff, the responsibility lies with the government to come up with a plan. If there is a problem in terms of people being able to find beds, you can't be in denial. You have to find solutions. And let us at least accept the fact that there has been some problem with containment measures and implementation of norms, including VVIP violators, including ministers who don't follow the rules, Dr. Rangappa. There is no point in denying all of it. Numbers are telling you the story, sir. Numbers are telling you the story. Let us at least admit it now and change the reality. Prepare ourselves better. If we didn't use the last 3 months to prepare ourselves for this eventuality, which would have happened any which ways whenever we unlocked our cities, it would have happened. Cases would have gone up and they have gone up. But at least we should have, by now, have a system in place. Where does a person go when they need a bed? Is there a centralized system? Are people being told where to get admitted, when to get admitted, and for how long do they need to be there? Where is the medical staff? Have you not heard that doctor put out that appeal? Somebody who is working from 7 in the morning till midnight, day in, day out, is putting out an appeal asking others to not be scared of COVID and come forward and help. PPE kits need to be provided. People need to be paid properly. These are all also responsibilities of the government. Public and private sector needs to work together in the pandemic. A pandemic cannot be an excuse for us to shut up and not ask questions. It is a time for all of us to come together, find the problems and fix those problems. And right now, Bengaluru needs it more than any other place. Thank you so much for joining us on this conversation. Welcome back. Here's the latest pot boiler from Kerala, viewers. It's a gold smuggling case that has now reached the doorstep of the Chief Minister's office, with some sensational turns and twists and links that have emerged now about those who are involved and their alleged link with the higher-ups. Now, let me explain to you what's really happened here in case you've missed the story so far. The case was exposed after customs officials at the airport seized 30 kilograms of gold. Now, this gold was being smuggled in and it was put in a bag which was addressed to the UAE consulate, obviously in the hope that it's treated as a diplomatic bag, and so perhaps the scrutiny won't be as much. It was labeled as household items and was being smuggled in 30 kilograms of gold. Now, as the customs officials got suspicious and they opened this bag, they found what was happening. From here, the investigation then exploded, and over the last few days, several links have emerged. Now, the key suspect in this case, for whom the police is looking right now, is a lady called Swapna Suresh, who was allegedly a former employee at the UAE consulate. She's even worked with the airline food catering staff, and she's been at multiple places. There's many things in her criminal background that the police is looking at right now. It is this lady's alleged link with the principal secretary of the state that has really rocked the government, to the point that this top Babu, the principal secretary, the chief minister, has now been removed from that post. He's been sacked because of these links that have emerged. It's obviously become a war of words between the government and the opposition. The chief minister says, I have nothing to do with this. Why are you pointing the fingers at the state? Airports are the responsibility of the center. Go ask them. The BJP, of course, raising this issue and going after the Kerala government. But I want to get you the details of this story, what's exactly happened, and just how high up does it go. So first up, let me actually go across to Vijay Rajan, news correspondent with the News Minute. Sridevi, help our viewers across the country understand how is it that a smuggling ring and a smuggling racket with 30 kg gold has now reached the Chief Minister's office?
Tanvi, I think it's too early to establish that there are links with the Chief Minister's office, or like officials working in the Chief Minister's office. We know for a fact that the IT secretary of the state has now been removed from the post. He was also the principal secretary to the Chief Minister after public allegations saying that he had links with the prime accused in the case. But however, today the Chief Minister had spoken during the COVID-19 bulletin, and he was answering questions, which is when he said that there are public allegations now, and it was wholly up to the center to investigate this matter, and that the state government, these are his words basically, that the state government has nothing to do with the entire issue, and the center, because the customs department comes directly under the center, and the diplomatic bag in question was reportedly authorized by the UAE consulate and sent to the UAE consulate in Trivandrum. So he was saying that the state has nothing to do with this. And regarding the removal of the IT secretary, this is basically until investigations continue and something solid, like a legal allegation has been raised against him, it was appropriate to just place him away from the Chief Minister's office for the time being. These are basically his words.
Okay, Sridevi, the other aspect, of course, is this lady who is allegedly, known to the principal secretary, and that's how, he's now having to step aside at this point. Tell us about this lady. Who is she? Is there a checkered past involved?
So she was a former employee of the UAE consulate in Trivandrum. This was about 6 months ago. So both the accused, so far the prime accused and the other accused, who was Sadith Kumar, both of them used to work until 6 months ago at the UAE consulate in Trivandrum. And after which she was working in the IT department, and she was a contract employee there. So although there are allegations saying that she has direct links with the IT secretary, nothing solid has come so far. And, we have to wait for investigation to find out, to sort of throw up more details about this. Yeah.
All right, Sridevi, Vijay Rajan, stay on with me as you're the one who's closely tracking the story and have the available facts ready. But let me also say good evening to Dinesh Vashne, leader of the CPI, joining us right now. Mr. Vashne, good evening to you. This is tricky. And obviously the BJP has found ammunition to lash out at the government, but to have somebody this close to the chief minister with such links definitely raises questions about the level of scrutiny that is used before appointing such people.
Look, Tanvi, there are certain facts which this young girl of yours, reporter from Trivandrum, is also saying the same. Look, the custom department comes under the government of India. The diplomatic bags, diplomatic missions comes under the government of India. This lady, Swapna, was outsourced employee. She was outsourced employee of an outsourced company which IT department has given. The Kerala government, the moment came to know, immediately took a prompt action, and IT secretary was removed. Whosoever else is involved from the Kerala government will also be removed, I assure you. And we have no objection. Let central government do any investigations by any agency, but we are very clear that none of our leader is involved in this thing. None of our government is involved in this. Everywhere in the government of India, also in any other state government, you find the functioning that many of the IT projects have been given to a company, outsourced company, even in the initial stages, even for survey purposes, even for initiate purposes. So any employee become corrupt or involved in the corruption, it does not mean that he or she has a links to the chief minister directly. If the IT secretary has been removed, let there be investigation. We have no objection. The problem with the BJP and opposition Congress is that they are envy to the success of dealing by the Kerala government towards the COVID-19. The Kerala COVID-19 dealing has become a world model. And popularity of the LDF government is so high at present in the Kerala that BJP and Congress both are put out to what to do with this thing. That's why. And we again say, let there be an investigation. We are not involved. Everybody who found to be involved will be removed, as IT secretary has been removed.
Okay, let me also bring in Mr. KJ Alphonse, member of the Parliament of the Rajya Sabha of the BJP, joining us this evening. Mr. Alphonse, you heard what the leader of CPI had to say, that this is nothing but, politics being played out because the BJP and the Congress don't have anything else when the Kerala government is so successfully really managing the COVID pandemic.
I think let's not really mix up the issues. COVID pandemic is a completely different subject. See, the connection to the chief minister's office is so obvious. The principal secretary to the chief minister is also the IT secretary who appointed this lady as the operations manager in an IT outfit which is managed by the state government, Space Park. And this lady apparently was dismissed from the UAE consulate due to some misappropriation case. I mean, I don't know exactly the details. So it's very simple. As per the law of torts, the employer is responsible for the actions of the employee. In this particular case, it's an IT employee who's been responsible for this international racket. I mean, that's what is alleged. And the IT secretary went out of his way apparently to protect her and also to ensure that this international smuggling racket goes on. Apparently, he spoke to the customs people to get the goods released. I mean, this is what I understand. And therefore, the connection is very apparent. I also need to raise, I think, a couple of other relevant national security issues. How come the diplomatic bag has been used to smuggling gold? And obviously, it means involvement of some foreign officials, foreign service official in Dubai who sent this diplomatic bag. I mean, this is what happens. What happens to the security of the country? Gold smuggling is just not an economic activity. I think it jeopardizes the security of the country because money is used very often in terrorism activities. Number two, how come the consignment was addressed to the consulate in Trivandrum, and then apparently the consulate official, senior official, also rang at the customs office in Trivandrum to find out whether his consignment is come. So the kind of connections are very simple. A diplomatic bag comes in with gold to the consulate here. So international connection, smuggling racket, which involves also possibly the foreign ministry of a foreign country. And then, of course, here the chief minister's office making it all possible. But you see, this history repeats itself in Kerala. During the last Congress regime, Mr. Ummanchandi's office was being run by one Sarita, who was called the Solar Sarita. I mean, people in her office, in Chief Minister's office, was functioning on the directions of this lady, and 3 people were indicted in the Chief Minister's from personal staff, and they were dismissed from service.
Mr. Alphonse, let's restrict it to this because this is what's happening now, and this is where we may want to seek accountability. And let me just get Mr. Dinesh Varshney to respond to the very interesting points that you've raised here right now. Yes, Mr. Varshney.
Look what Mr. Alphonse is saying. I again repeat, if outsourced employee of any private company which has been outsourced by the IT department are involved in any type of corruption or smuggling, how does it come to the state chief minister or the chief minister office? Any IT secretary who is in charge of that IT projects have been removed. And I again say, Mr. Alphonse, whatever the gold has come from UAE, it is under your central government. The diplomatic bag is under your central government. You are welcome to cancel the facilities of the diplomatic bags sent by the diplomatic missions if you can dare to, because it is under the international conventions, which you cannot dare to. You have only one point, because you are perturbed by the great success of the Kerala government by dealing with the pandemic, corona pandemic, which the central government could not do it. The central government is not done it. They said the people should learn to live with the corona. They have not done enough. And Kerala dealing with the pandemic has become a world model. So the people of Kerala is fully supporting the LDF government. They have no other issue. Earlier there is Sabrimala. Now these all right reactions. Unfortunately, even Congress sometimes
that and all is fine. That and all is fine, Mr. Dinesh Varshney. But tell me this, Mr. Varshney, pending the investigation, how are you able to give a clean chit? How do we know without the investigation? You say that this man has been sacked because there was, public scrutiny and questions that were being raised. But without an investigation, aren't you jumping to the conclusion?
I am not jumping to the conclusion. I say, tell me any department of the government of India dealing with the ITs or any other thing. The government India is involved in the wholesale selling of the PSUs and wholesale outsourcing of the employees. And this is how it has been done in most of the state. Almost all the state government do it because of the IT technological knowledge and technological expertise. If employee of the outsourced company is involved in any corruption, I again repeat our stand. Let there be an investigation by any agency. Let central government investigate. And I repeat, the customs department, the diplomatic bags, the diplomatic missions comes under the government of India, not under the government of Kerala or any other state government.
Okay, quick response from Mr. Alphonse. Go ahead, please.
Mr. Varshney, I belong to the Kerala cadre of the IAS. I was an MLA from Kerala after that. I was a
I know,
union
Alphonse, I know
I'm
you
a
since you were
union
in,
minister,
when you were
and
in
therefore
DDA. I know you when
yeah.
you were in DDA.
Okay, so let me assure you, I know Kerala very well. I know how
I know
things
that.
function. You forget. No, please don't interrupt. Let me
You were a very nice officer.
let me finish.
Yes.
Don't
Mr.
interrupt me.
Vashne, let
Please
him
don't.
make his point, please.
Please. You forget, Mr. Vashne, that the officer concerned is a principal secretary to the chief minister. Very simple. And therefore, as per the law of torts, whatever is done by an employee, your employer is responsible. And especially when you are in the chief minister's office, you appointing a person who has been sacked by the UAE embassy for whatever irregularities, and then it is your job to check credentials. If you didn't do that, whatever your employee does, you are responsible. She was a project operations manager of Space Park, which is an outfit of the state government, of the IT department. And here, once the consignment was caught and you found there was gold smuggling, the chief minister's office, apparently, this particular officer, I mean, these are yet to be established in investigation. He rang up the customs and threatened the people, saying that you have to release this. And also the fact that that people use pressure to get this consignment released. Now, all these points to where it's very obvious the chief minister's office, and that is why I'm saying, for those who do not know Kerala history repeats itself in Kerala. Last government, let's not forget this. Last government was ruled, Congress government, when Ummanchandi was chief minister, it was Sarida who governed the chief minister's office. This time it's a smuggling racket. I mean, this has to come to an end, Mr. Vashne. And all you're saying, dealing with the pandemic is fine. I'm not debating any of that issue. I'm not. I also give some credit to your government on that. And after all, I was an independent MLA supporting your government. Therefore, I'm aware of what happens here. With all responsibility, let me tell you, take a responsibility. I'm sure the central government will investigate all these international protocol of question of diplomatic baggage. All this will be investigated by the customs and by the MEA and by the DRI. I'm sure they will investigate. But let's not give clean sheet to people before we know the facts.
All right, I'm completely out of time. Fact of the matter is that the man at whom fingers were pointed has already been sent out of the Chief Minister's office. He is no more the Principal Secretary to the Chief Minister pending this investigation. Fact of the matter is that the lady at the center of all of this is yet to be found, and we are yet to find out that part of the story. But the fact that everybody also knows is that there was a smuggling ring, a gold smuggling ring that has been busted. Beyond that, what's true or not, it is for the investigative authorities to tell us and tell us just how high up does this go. Completely out of time. Thank you, Mr. Vashne. Thank you, Mr. Alphonse, for joining us right now, and to Sridevi for bringing us all of the details of this story. We've got some more breaking news coming in. Well, the Visakhapatnam police has arrested 12 people associated with the LG Polymer Company management in connection with the gas leakage incident that took place on May 7th that had claimed 12 lives. Remember, the CEO, 2 directors, and 9 more people have now been arrested. This is the first set of arrests that is actually being made 2 months after that incident, that disastrous incident on a horrific night in the early morning hours, where people were forced out of their homes as the gas leak began. People were fainting on the roads. 2 months after that horrific incident, we've now got our first set of arrests coming in after the probe committee submitted its report that held the company accountable, that found a series of issues that the companies had not followed, rules that had been broken, safety precautions that had not been taken, and for that reason now you are seeing the police move in and start taking action. The CEO and 2 directors of LG Polymers along with others have been arrested. So this is the latest that we get to you, because earlier we also had the probe panel chief talk to us in detail. We've got the police arresting 12 people associated with the LG Polymer Company management, CEO, 2 directors and others. Because a series of rules and regulations were not observed, safety protocols are not followed, even the basic checks were not found in place by a probe committee that had been set up by the government. 2 months after this horrific incident, 12 people have now been arrested. With that, it's a wrap here. We take a quick break. Thanks for joining us.